Hi friends, welcome back to my channel Sharing Simple Knowledge. I hope everybody is doing good. Today again with another case note explanation. So let's read the case note first. Today's date 14/5/2020. You are a nurse working in Stellar Clinic, Newcastle, UK. Matthew is your patient. Clinical details. Name Matthew McConaughey. Date of birth 29/6/2009. That means age 10 years. Parents Mr. David McConaughey and Mrs. Susan. Address 13B Baker Street, Newcastle. Then bronchial asthma 5 years. Using an albuterol rescue inhaler approximately 3 times per week for the past 2 years. Intermittent chest infections last 6 months. No family history of asthma. These are the clinical details they provided. Then on 5/5/2020, complaints wheezing, chest pain, dyspnea and cough. Chest X-ray and CT scan normal. Spirometry forced. Expiratory volume 78%. Then the medications are low-dose corticosteroid. Fluticasone 44 microgram at 2 puffs twice per day. Then on 7/5/2020 remains symptomatic, mild fever, increased use of inhaler noted. Chest X-ray normal, inhaler dose increased to 2 puffs 3 times per day. These are the changes happened within 2 days. Let's move on to 9/5/2020, wheezing, chest pain, dyspnea and cough. Allergy skin test positive for dust, trees. Diagnosis refractory asthma. Included anticholinergics and leukotriene modifiers. Monitoring of breathing pattern. Steam inhalation and other non-pharmacological measures to relieve cough. These are the management they done on 9th. Then on 14/5/2020, wheezing, chest pain, dyspnea, cough, thick secretions and fever. Pale and weak. Urgent reference to pulmonologist. May require bronchial thermoplasty. Further investigation may needed. From all this information since admission, what we notice, his condition is deteriorating or worsening. So that's why they are referring to a pulmonologist. So what you have to do, you have to imagine the situation in your mind from the beginning until the end. So it will be easy for you to write this letter. Once you imagine your mind, you can transfer in your own words. You can just write like a story. So that is the thing they are expecting in the letter writing. Not copy the same words from the letter or case note. Okay, so the writing task, using the information in the case notes, write a referral letter to Mr. Mark Ruffalo, pulmonologist. So how we can write? Mr. Mark Ruffalo, pulmonologist, Freeman Hospital, UK. Then the date is last date we can put here, but during examination the exam date only they will give. So 14 May 2020. Then how the salutation, dear Dr. Ruffalo, comma, reference. As his age is only 10 years, no need for any salutation. You can put Matthew McConaughey. Then date of birth is 29 June 2009. Then how we can write the introduction? I'm writing to request an urgent visit for Matthew McConaughey, who has worsening symptoms of refractory asthma. Because we can see the condition is worsening, or whose condition is who has deteriorating, like that we can write. Then he requires immediate care and management. Then we can write the next paragraph. We can give some past medical history, so they will get some awareness. Matthew has had bronchial asthma at the age of 5, or since the age of 5, for which he is on, or he uses albuterol rescue inhaler 3 times per week for the last 2 years. Then apart from that, he has developed intermittent chest infection since last 6 months. Then please note he has no family history of asthma. Then next we can move on to the next paragraph. Initially, Matthew presented to clinic on 5 May 2020 with the complaints of wheezing, chest pain, dyspnea and cough. On assessment, his spirometry revealed 78% of forced expiratory volume. Therefore, fluticasone 44 microgram at 2 puffs twice a day has been recommended for him. Or we can write also he was treated with the fluticasone 44 microgram 2 puffs twice per day. Then next paragraph how we can write. On his subsequent visits, Matthew represented with same complaints or persistent complaints we can write, along with the mild fever and increased use of inhaler. Therefore, his inhaler dose upgraded to 2 puffs 3 times per day. Then what else done? His allergy skin test is positive for dust and trees. Consequently, his diagnosis was confirmed and he was prescribed with anticholinergics and leukotriene modifiers. Then next paragraph. Today, Matthew brought to clinic with worsening symptoms, including thick secretions and fever. On examination, he looked pale and weak. And the recommendation what we can write, your immediate consultation and further investigation, especially bronchial thermoplasty, would be highly beneficial for Matthew in order to confirm his diagnosis. Then as the name is given, you can write yours sincerely, registered nurse. I think it's clear for you. If you can paraphrase more, it will be better. Okay, thank you for watching this channel and supporting. And if you are watching first time, please subscribe, like and share with your friends as well, so they can also get